27, she knows lockdown.
She knows that.
Yeah.
Nói à.
Nó à.
Nói à.
À, con nó à. Nó à.
So take a deep breath.
Cô hít thở sâu.
So it's commonly misunderstood about what kills people, I think, in the world, and chronic diseases is still the #1 killer in most parts of the world. And in Vietnam, it definitely is about 60 to 80%. These are estimates by the World Health Organization. About 68% of the deaths here are from chronic diseases of adulthood, and those are preventable diseases. And like I was telling you earlier, they're not very sexy, so it's easy to, you can show a young disabled child, that's something that people are very eager to get money to, but if I introduce you to her blood pressure is 140 over 80, and that needs to come down. That's not something that's easy to sell. But if you can take care of high blood pressure, diabetes, cancer prevention, those kind of things, those extend people's lives, and it's just not easy to sell that. It takes a lot, it's very labor intensive, it's not easy, it's not just giving someone a wheelchair or giving someone a splint, she will be easy to take care of, but we have a lady who we take care of, Miss Lung. She's lost her legs in a landmine, and she smokes a pack a day. She has diabetes and high blood pressure, both of which are fairly severe. And that's to take care of her, to get her healthy, is going to take 6 months to a year. Titrate meds, and it's expensive and it's hard to do, but doing that will extend her life. It will prevent heart disease in her.
And why do they need, right now, let's say with people in these cases in Vietnam, why do they need help from outside? How much of it they are getting it here? So that's why this much, or this is the reason we need some volunteers from overseas, and also what you're providing here versus what they have access to.
The medical training in Vietnam is different than the West, and some of the chronic diseases don't get treated in the way we're used to treating them. To get chronic disease better, you need to have continuity of care. So you need to continuously see them and treat them, and they need to be educated about it. A lot of times what you see here, when someone has high blood pressure, they'll see the doctor and they'll get a week or 2 of medicine for high blood pressure. And then follow-up gets lost and they don't go back to see the doctor. And a lot of times they'll get medicines, they don't know what the medicines are, so they don't go to the pharmacy to get new ones. And there's not that continuity that you need to get these things better. So for chronic diseases, I think they still have a way to go as far as treating them. Diabetes is another one. I think we have a diabetic patient that we started treating with insulin about 10 months ago. And it was a new thing to her to be on insulin. We gave her a glucose monitor and teach her how to check her sugars. Her diabetes is very bad. And there's not a lot of that done here. So diabetes, I don't think it's looked for, and it can be also very silent for a long time. And it doesn't get looked for, and when it gets treated, they don't have a lot of experience with it. So they give a couple pills, and people will still have sugars that are 2 or 3 times normal. And as you know, that sugars 2 or 3 times normal, you're at risk of all the end-stage complications of diabetes. Right. So I don't know if it's the education or just the system that they have set up, but it's difficult for patients to see a regular doctor and get medicines and get treated for these diseases. Sometimes they do, but when you get out to the countryside, they don't. There's a doctor shortage, the medicines are hard to get out there, so there's all these barriers that we are encountering to treating these common diseases. We're trying to overcome those.
How much time do you spend here seeing people here, and how much time on average do you spend actually traveling that you go to other villages? Well,
it's going to change, I can tell you that. It's going to change a lot. Right now we spend, most of the patients we see are here. We do there's some patients we see in town, home visits. We have some patients who are quadriplegic who we go see them because they can't visit us. So we do some home visits. A lot of the home visits are from younger people, more severe conditions. The chronic diseases in the elderly, most of them we get to come here. Even if they're disabled, they come here. We have a great story of a gentleman who was 33, got in an accident about 6 years ago, fell off a ladder, is a paraplegic, not a quadriplegic, and he wheeled himself out here. It took 3 hours to get here in a wheelchair. And had I known that, we would have gone to see him at home. But they come to see us, and it's impressive.
How did they hear about you?
Well, there's a disabled support group in Hoi An, It started a few years ago, and all the people who are disabled come together, and it's great for them. They get to talk and share stories, and it's kind of unique in Vietnam, this support group. And that started, and I approached them, the lady who ran it said I would offer healthcare to them through another foundation called Life Start. Life Start's from Australia. They kind of helped this group, and I offered to do the healthcare. So we met them, started with them, and then found out through them that a group is starting in all the districts. So there's a group in Vinh Bang that's getting together, and that's a district not too far from here, and then East Sweden. So going to those groups is a great way to get people who are disabled and disadvantaged and all who have chronic health.